Great. Thank you, everyone, for coming. We are really excited to be here today to talk about, provide a little bit more detail for all of you about our experience of implementing Meducation at Dignity Health. My name's Tiffany Shields Tedemonte, and my colleague here is Sarah Toy Ding, and our fearless leader here is Terry Wilson, who actually got this whole process started for us. So I'd like to start with just a little bit of information about Dignity Health. I don't know of you that live on the West Coast, but for most of you, I'm sure that you've seen our commercials about Hello Human Kindness. And it actually really pinpoints who we are as an organization. But just a little bit of detail about Dignity Health. We are actually a very large organization and getting larger with 39 acute care facilities and over 400 clinics in over 22 different states and expanding. I'm not sure if you guys have been following the news, but recently we agreed to converge with CHI, which will now make us the #1 nonprofit healthcare system in the United States. So we're really excited about that. More details to come on what that's going to look like, but we are definitely growing and really lucky to be in this situation. So we have over 8,500 acute care beds and over 62,000 employees at Dignity Health. But I think what really sets us apart is this screen here that talks a little bit about why this Hello Human Kindness. So this is our values that are really important to us as an organization. And you can see there that it's no coincidence that our name is Dignity Health, and one of the very first values you'll see listed there is dignity. And it definitely is we walk that walk every day, and it's really important to us that we not only show dignity to our patients, but to each other as colleagues. So it's very much a part of what we do. But in addition to that, collaboration and justice, stewardship, and excellence are also part of our core values as an organization. So that's a little bit about Dignity Health. But the next thing I want to talk about is a little bit about why Meducation. So as a large organization, you probably are aware that a lot of us, we're located in, a lot of our acute care facilities are located in the state of California. And an interesting fact in California, is that in the state of California, 43% of our population there speak another language other than English. And so that became a real big issue with us at Dignity Health of how do we provide this important information for our patients and in languages other than English. So it was something that we really had to figure out. And then additionally, across the nation, 21% of our patients have a limited English proficiency. So again, this was another thing that we are really dealing with how do we provide information for our patients to ensure that they had all of the tools that they needed to go home safely, know exactly what to do, and make sure that they were equipped with the information that they needed to stay safe. Unfortunately, the Wi-Fi is not working, but we have a really funny clip here, and I'm just going to act it out for you, just because. Seriously, if you look on YouTube and look at the house, and I'm not an idiot, you want to check it out. It's actually kind of had me laughing out loud the first time I saw it. But essentially, let me kind of summarize what this clip is all about. It's from House. I don't know if anybody watched that. Really dry humor. And House is interviewing one of his patients that's had frequent return visits to the emergency room. And his patient, Peggy, has asthma. And he's like, what is going on? What's going on here? I just want to know, are you having problem with your inhaler, or, what's going on? And she's like, you know, I'm not an idiot. I know what I'm doing. And he goes, okay, well, can you demonstrate how you're using your inhaler? And she's like, yeah, of course. Click, 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 click. So she's spraying it like perfume, and she's not inhaling it all. And it actually kind of gives a really good demonstration of, you know, this is definitely one of the things that we're faced with when we're sending patients home. We have quick, limited turnaround times to get these patients home, and do we really have the time and the capacity to go through that level of detail that they need to know how to really take their medications? So if you get a chance, check out that video. But one of the quotes that are really kind of nail this down is that drugs don't work if patients don't take them, right? And medicines left in the bottle can't help. So that was definitely one of the things that we were looking at. And if you think about some of the startling statistics that really started to drive this point home, is that 30 to 50% of medications are not taken as instructed. Think about that. And then if you start to look at some additional statistics here, 10% of all of the hospitalizations are related to medications that aren't taken correctly. So patients going home not knowing how to take their medications, that is related to 10% of all of our hospitalizations. Additionally, 26% of all of our readmissions are related to patients not taking their medications as prescribed or inappropriately. And you can read the statistics up here. I mean, each one of them get more and more startling. 125,000 deaths related to medication complications. So again, it's a big problem. People really need to know how to take their medications. And then additionally, we kind of already referred to this, but low health literacy is a real problem. You can see the Affordable Care Act has lined that out and really described what that is. But it's our patients' ability to obtain, communicate, process, and understand what to do as far as their health information. And so what we know is that 44 million adults today read below an 8th grade level. So think about the education that you're handing to your patient today, and how many of our patients are really understanding what we're handing them and can really do something with that information. And then this slide really shows, okay, so we have patients that are reading below an 8th grade level, that can't see, that have low health literacy. And this is a pretty classic example of what we're handing most of our patients as they walk out the door, right? So they get these little scripts, they can barely read it, and we're like, okay, you're all good, and see you, and take care, good luck. And so this is definitely leading to the problem. So we want to show you what we were able to do with Meducation, why we're so on fire about this and up here talking to you about it. So this is the why. So if you look at this, this is what the Meducation handouts look like. So you can see that it's a larger font, it has pictures, and it's written in a patient-friendly manner. So those people that are having difficulties understanding it can really start to capture the important points on what they need to do. And then additionally, there's this really amazing calendar that they include in here, which shows you with pictures exactly when I'm supposed to take this medication. It's got a little sun for take this first thing in the morning. And so these are tools that we can give our patients that even if they're not able to read it, they can definitely look at these pictures and have a better understanding of what to do. And then there's these awesome little videos, and again, I hope you guys look at that house clip, but this is it's a demonstration of how to use your inhaler, what's the proper way to take it. And so they have all of these tools that are available for them with the Meducation product. And then additionally, they have this in all of these different languages. So oftentimes, I know that a lot of us have faced this, and we have Spanish, available. But what we know is that we have patients that are speaking all kinds of different languages, and we really have a void there as far as what we can hand them and have them walk away and really understand. So you can see that we have a long list of different languages that are available with the patient instructions with our Meducation product that we're really excited about. And then finally, another really large benefit is that not only can we hand this to our patient, but also this information goes into their patient portal. So we know with meaningful use that we're shooting for that 10% goal of getting our patients to log into their portal and see their information from their admission. And so with this, all of the information that they've received from our Meducation processes are available to them to access and really share with their family members and refer to when they're feeling better. So that's available to them as well. So we went live with Meducation at Dignity Health a little less than a year ago, and so we haven't had time to really assess all of our metrics and pull all that together. So what I have here is just a few metrics from other clients of Meducation just to show you the impact. It's pretty profound. So here is an example where there is a 52% improved medication adherence with Meducation. This was measured 2 weeks, and what you can see is that there's a 24% decrease on patients that are saying, when do I know what time of the day to take my medicine? And so you can see pretty profound 52% improvement here. And then with another client, we saw a 77% in improved medication compliance with this. And so if you get some time, you can take a look at this, but basically we are surveying the patients and asking them, do you know when to take your heart medication? And this showed within 90 days a 77% improvement with that. And then finally, the last thing is that I think it's kind of a no-brainer when we're handing patients information that they can understand with pictures and calendars and that type of support, that they're definitely going to be satisfied with this. And so this is another example where we're seeing the HCAP scores improve related to the Meducation. So that's kind of what you get with this, but I'm going to turn the time over to Sarah to kind of talk to you a little bit more about our experience at Dignity Health as we are implementing this amazing tool.
Thanks, Tiffany. Okay, so let's talk a little bit about Meducation and the integration with our electronic health record at Dignity Health. So basically it was a collaboration of 3 different groups. Sorry about that. Okay, so first we had Dignity Health, of course, we had Cerner, and then we had First Data Bank. So we worked with Cerner to set up the FHIR web service. They also helped set up all of the Meducation documents and our discharge summary workflow for our clinicians to hand to our patient population. And then we worked with First Data Bank for the testing and the issue resolution. So it was a collaboration of all 3 organizations via the Smart on FHIR application. So we were one of the first of its kind, and we're really excited about that here at Dignity Health. So some of the feedback that we've received from our nursing population is that they feel much more engaged in counseling patients on their medications today. They appreciate being able to communicate in the patient's primary language and being able to offer them different font sizes for the information they're providing them. The one thing that they did explain to us that they were surprised about, in us too, was that the discharge paperwork increased in length, or the number of pages that they were providing to the patient. But if we think about that, it makes sense, right? Because now we have pictures and graphs that we're providing them and larger font sizes. So it wasn't a negative per se, but just something the departments needed to be aware of from a supply standpoint, and knowing that they had to pass out larger packets to the patients to take home. Our patients and caregivers, the great feedback we received from them is that they have a better understanding and fewer questions on the medications that they're going home with. So if you think back to some of the staggering statistics that Tiffany shared with you, that 26% of all admissions are avoidable if patients know how to take their meds at home, and 72% of adverse drug reactions after they get home are preventable if they know how to take their medications. So this alone, this feedback was great to hear. And then the calendar view, which is what Tiffany showed you, it's kind of that Excel spreadsheet. So it gives them pictographs of a sun and a little bed to tell them what time of day to take their meds, how often to take their meds, and the detail of those medications. Next slide. And then some of the lessons learned, this is something that we always do at Dignity Health after our projects. take place, and hopefully this is something that some of you out there in the audience, if you're considering Meducation, can kind of take back to your facilities. But one thing we wanted to note is clearly define the training methodology. So we train to functionality instead of workflow, and the functionality is fairly straightforward. So we created all of our tools and tip sheets and things like that for the functionality, but actually the workflow is what presented itself throughout the implementation, and that's what really encourages adoption. So we kind of scrambled a little bit during the implementation to provide them additional addendums to training documentation, and so that's something that we wanted to call out. Know the current state medication reconciliation processes. So I'll be honest, we have over 30 hospitals. Everybody's doing things a little bit differently, sometimes unsupported ways or spoken ways. So this really called out an area that we needed to work on as an organization. It wasn't Meducation, but it was our processes within. Home medication documentation can be incomplete. So we kind of found two instances where this occurs. One, the patients are coming in and nursing staff is in a hurry. They're trying to gather as much information as possible. So they're just gathering the drug. They might not always get the strength or the dose or any additional information thereafter. Also, something else that we found is when we went live with medication reconciliation to encourage our physician adoption, we educated the nurses to really just enter the drug name as really just as simplistic as possible. So that way when the doctors came in, they didn't have to change the existing footprint, they just needed to add to. And so with Meducation, the more information you have, the better this system works. And so we found that to be something that we needed to work on as well. And then lastly, these were all barriers that we encountered, but overall we said engage leadership early, which we did successfully at Dignity Health. And so these barriers we were able to work through as an organization. I remember talking here to Terry earlier throughout the project and just asking her, why was leadership so engaged on this project? Why were they so passionate? And she said it really came from a personal level, and that many of them have aging parents or aging relatives, and as they're going through our hospital systems, they're confused on what they're going home with. And so she herself has created a handwritten document like the calendar view for her parents to know when to take their medications. And so when Dignity Health leadership saw this, they thought it was really something that they could implement and be successful in our organization. So the next couple of things here at Dignity Health that we're watching for is that Meducation will now be embedded into our discharge summary workflow. So today it's outside of that process, so nursing has to go elsewhere to get the information. And in the future, it'll be in their discharge checklist. So it's a one-stop shop. It's a lot easier for their day-to-day workflow, and they're really excited about it. The discharge and meds rec process, as we said, that kind of this project highlighted the issues that we had in that process, in that area. So Tiffany, actually now we have a project this fiscal year to look at that as an organization and make a recommendation for the enterprise as a standard going forward, so that Meducation is more successful and our physicians are more successful with that. Also, something that Meducation, there's an enhancement coming out, so the automatic feed of patient language preference. So when the patients are coming into our facilities, initially they're filling out all that paperwork and they say what their primary language is. Now that'll carry forward into Meducation. It's one less click the nurses have to do when they're in Meducation. They just have to verify that that's the language the patient would prefer. So that's nice for them. We're also looking at the expansion into what they call Meducation bedside or Meducation inpatient, which is the education of medicines while the patient is acute or inpatient. Right now we're just doing on discharge, so that's something we're looking at in the next fiscal year. And then also the expansion to those 400 plus ambulatory clinics so that we can hopefully close the loop on medication reconciliation for our patient population. So lastly, I just kind of wanted to summarize why medication matters to us at Dignity Health. It really coincides with our values that Tiffany mentioned earlier. It also helps to have patient-centered care. We're educating our patients so that they feel empowered to make the decisions on behalf of their health care going forward. And then lastly, it's really just opening up that communication between our clinicians and our patient population so that overall they receive better health care. So with that, I'd like to thank you for your time today, and Tiffany and I will take any questions. I think we just have a couple of minutes if anyone has anything. Okay, if not, thank you everyone, and we will be around. Have a good day.